Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
We are talking about the heart. Now, everybody knows the heart is so important. It is, I would say, Dr. Jitka Lom from ExpressCare, the most vital organ?
It pretty much is. Yep,
Yeah.
that in your brain.
Yeah, well, one of two or three have top priority.
Yep.
Okay, so talking about the heart, let's talk about things that were science and technology created to help the heart. We know pacemakers can be inserted if people have, like underperforming hearts and everything. What exactly is a pacemaker? Like, what does it look like, and like, is it
So
like
it's a little
engine?
flat. No, it's a little tiny little flat disc. Inside there's a battery that's very long lasting, and it sits in the chest wall, of course, and then there are little wires that connect to your actual heart, and it gives little electrical impulses. So if your own heart isn't firing off, meaning there's electricity in your heart, and it's in a very specific orderly pattern, and if your own heart is not maintaining that pattern, particularly if it's too slow, you put the pacemaker in, and so it will kind of speed up the heart. It will help it give it a little boost of electricity to make the heart contract. And so that's typically in people that have an irregular heartbeat or a very slow heartbeat, sometimes a very dangerous heartbeat pattern that we put a pacemaker in. And it doesn't hurt. The incision is very small. They place it in, and then it immediately will start to function. And then you have a tune-up on your pacemaker, usually about once a year, to make sure the battery's okay and to make sure that it's working just fine.
So the surgery is actually minimally invasive?
It's very, very simple.
Even to do the wiring?
Yeah, I mean, it's all done under imaging. You see where everything is going with ultrasound and so on. And so there's just local anesthetic, a little tiny bit of anesthesia under the skin, and then they slide the pacemaker in and the wires in, and just most of it is just the tuning. The cardiologist, that's the heart doctor, is checking to see how the electricity is transmitting to the heart.
That is astonishing.
It doesn't take too long, maybe about an hour to put in a pacemaker.
Usually
they give the patient just a little tiny bit of sedation so they feel calm.
Sure. How far has the practice of cardiology come in, like, say, like the last 400, 500, 600 years?
Oh, not even in the last 20 years. Last year, last year we were fortunate at the Guam Medical Society. Dr. Shea brought in a very amazing cardiologist, and she brought actual heart pumps with her. The type that they use when the patient is having bypass surgery to slow down, or to stop the heart, and basically a heart pump. And the first generation was this big, huge, heavy metal thing. And then the latest generation is just a tiny little electrical device, tiny little pump that can actually be placed through a vein. So these days,
that small,
that tiny, yeah.
Wow.
These days, there's so many advances. So we have some great cardiologists on the island, and our heart care is so much better even than when I came 18 years ago.
Yeah, we have heard that Guam's cardiologists are very, very reputable, very
much
nice
better.
people.
Yes.
Okay. Well, of course, I like how you talked about stopping the heart, because Hollywood has taught us that the paddles, which used to be like these long things with like these discs on the end, and they became, the paddles with the two buttons and everything. It requires a tremendous amount of literal shock to restart a heart. Are we ever going to get to a point in medicine and everything where it won't have to be that violent of a transaction to restart a heart?
You're right, it is pretty violent. I don't know about what the future will bring, but these days, still, if somebody is basically having a flat line, meaning their heart is not beating, we still use that massive amount of energy applied to their heart. They're usually unconscious at that time, and we place like a gel pad on the chest first so that it doesn't burn the chest, otherwise it would, and apply the paddles, and everybody stands back, and then the patient gets shocked. And
very famous clear.
Yeah, clear, and it does bring people back if we're fortunate and we do it soon enough. So the reminder to the audience out there is, if you are having chest pain or you're having problems, get yourself to the emergency department. Don't blow it off till it's too late.
Now that's a good transition, because a lot of what we see sometimes, not from Hollywood, but in the real world, is when people say they're having heart attacks. Among some of the symptoms they have is they say, like, I'm getting a numbing sensation or a tingling in my left arm.
Yes. So these are the things
Why is that in the arm?
Well, the heart sits on the left side of the chest, and sometimes the pain radiates from the heart to the arm, the shoulder, or the jaw, or the neck. And so if you're having strange pains like that, especially on exertion, meaning you are exercising or climbing stairs, working, and you start to get this discomfort, and then you stop and it goes away, that's a very big warning sign that your heart is under strain. And especially women, we tend to have different symptoms. We don't have the crushing chest pain. We have this strange feeling in the jaw. We may have nausea, breaking out in a sweat, feeling weak and dizzy. These are all symptoms for women, so they can be much more subtle. And if you have a family history or you already have high blood pressure or diabetes, your symptoms may be very, very minor and important to get them checked.
Okay, final question, and we'll wrap up with this last one. The heart does so much for us. What can we do for it? You already mentioned about taking the omega-3 oils and eating lots of fruits and veggies and being healthy. But in summary, what can we do to take care of our heart?
I think the best thing you could ever do for your heart is to take it for a walk. And that would be a 30-minute walk every day, to exercise it. Just like you take your dog out or your children or whatever, take your heart out for a walk. And studies have shown if you want to do one single thing for your health, taking a 30-minute walk every day will help your heart, it'll help your brain, it'll help your longevity, it'll help prevent many different kinds of cancers. And it will also make you more stable and fit as you get older so you don't sustain falls. So try that one out.
All right, and ladies and gentlemen out there watching this on TV, you have 2 of mostly everything in your body. You've got 2 hands, 2 feet, 2 eyes, 2 nostrils, 2 ears, 2 lungs, and 2 kidneys. You've only got 1 heart.
So take good care of it.
All right, that's the word. Stay tuned, everybody. We are back after this.